Hello, everyone. My name is Brian Johnson. I'm a PGY1 pharmacy resident at Xavier University of Louisiana. Today, I'll be presenting a research project titled The Implementation of an Educational Program for a College of Pharmacy Preceptors called MiniBites and its Effects on Knowledge and Perceptions of Opioid Use Disorder. Firstly, I'd like to acknowledge my research team, Dr. Maestri, Dr. Hayes, Dr. Ekenga, Dr. Bailey Wheeler, Olivia Giddings, and Dr. Zhang. Their guidance and collaboration have been instrumental in developing this project. So firstly, I'll start with some background. Opioid use disorder, or OUD, is a chronic relapsing condition and it affects more than 16 million people worldwide and over 2 million Americans. In 2023 alone, there were over 79,000 opioid use disorder related deaths nationally. OUD is characterized by cycles of remission and relapse, and it is influenced by biological, genetic, environmental, and psychological factors such as trauma, family history, and opioid exposure. Importantly, even short-term opioid use can lead to physical dependence, as patients may continue to use to avoid withdrawal symptoms. In 2022, the MAT Act significantly expanded access to treatment, allowing DEA-registered members with Schedule III authority to prescribe buprenorphine without a special waiver. This was a major step in reducing the treatment barrier and stigma behind opioid use disorder. Pharmacists play a key role in this process by dispensing buprenorphine using prescribers' DEA numbers without federal patient gaps through state regulations, although state regulations still apply. The position pharmacists play is critical in access to opioid use disorder care. Despite policy improvements, gaps still remain. Nationally, only about 1 in 4 patients who have OUD receive treatment in 2022. Here in Louisiana, there were around 1,130 deaths in 2023 related to OUD. Jefferson and Orleans parishes rank among the top parishes for opioid use disorder related deaths. These numbers highlight the urgent need for improved education and intervention at the healthcare provider level. Pharmacists contribute through harm reduction strategies such as providing naloxone, sterile needles where permitted, fentanyl test strips, and counseling on opioid use disorder prevention or opioid overdose prevention. However, up to 70% of clinicians report lack of addiction counseling accompanying OUD treatment. Pharmacies are often most accessible healthcare setting, making pharmacists confidence and competence in OUD essential. Research shows significant educational gaps. One study found 55% of pharmacists correctly identified all 3 FDA-approved medications for OUD, and just 57% felt comfortable dispensing them. Another multi-state survey found that opioid use disorder interventions were underutilized, with only 26% of pharmacists feeling adequately prepared by pharmacy school to provide education. These findings clearly indicate a need for enhanced education and stigma regarding these. So the purpose of this study is to provide the Xavier University College of Pharmacy preceptors with a comprehensive educational platform designed to eliminate misconceptions and enhance knowledge surrounding opioid use disorder. By targeting preceptors, we aim to influence both current practice and future students through experimental learning environments. So this project will involve creating short educational videos using Camtasia, a video design studio, in collaboration with the Center for Advancement of Teaching and Faculty Development. Topics will include naloxone counseling administration, harm reduction strategies, identifying at-risk patients, and also addressing common stigmas and misconceptions. Each video is expected to take about 2 to 3 hours to produce. The program will be available for 6 to 8 weeks, and a pilot version of the program will be beta tested with select providers. So why MiniBites? So MiniBites stands for a short form educational video that's effective for healthcare education. Their brevity increases accessibility, especially for pharmacists with growing workloads, and reduces cognitive overload and enhances retention by engaging both visual and auditory learning pathways. By breaking the complex topics down into concise segments, MiniBites allows preceptors to engage with high-yield content efficiently. Participants will complete Likert scale-based pre- and post-assessment statements will assess confidence in identifying opioid use disorder, understanding harm reduction, and comfort counseling patients on naloxone administration. Now, surveys will be scored cumulatively to measure changes in knowledge and perceptions as well, with IRB approval recently attained. So, a primary outcome of the study is the change in knowledge and perception scores from pre and post intervention, measured using a 1 to 4 Likert scale. We hypothesize that the MiniBites educational program will significantly improve pharmacy preceptors' knowledge of key opioid use disorder concepts and correct misconceptions, with the goals of first improving knowledge and demonstrating a higher post-assessment score and reducing stigma associated with opioid use disorder. And third, we would like to enhance clinical confidence in identifying, counseling, and managing patients with OUD. And strengths of the study include cost effectiveness, efficient data collection, and anonymous surveys that may encourage honest responses. Limitations include potential self-report bias, low response rates, and the possibility of the survey responses not capturing the full complexity of these participants' perspectives. And if effective, the MiniBites platform could expand to other disease states that potentially may be adopted beyond Xavier University or within the university itself. Ultimately, this project aims to improve pharmacist preparedness in addressing one of the most pressing public health crises of today. And thank you all for your attention, and I welcome any questions. Thank you.